So, what is it? Stroke is a medical emergency. We know that a brain attack is called the stroke, and then here the time is brain, because every second lost you get lot of millions of neurons are dead. So, you have to have a fast assessment and investigation. Acute medical management will have to be started immediately, and immediate secondary prevention also will have to be done, and you have to recognize and manage the complications. When you take this chart, you find there are 4 different things. One is a cardioembolic stroke, then you have the small vessel disease and unidentified disease and the large vessel disease. Patients who have a large artery disease will have different stroke rates compared to those who have a small vessel disease. So, we have to identify whether it is a small vessel disease or the large vessel disease before we start on therapy. And when you come to the recommendations, there are 3 different classes of recommendations, actually class 1, class 2, A and B and 3. Class 1 means that treatment is recommended or is indicated. When it comes to class 2, class 2A you have weight of evidence or opinion in favor of usefulness or efficacy, but can be considered. Whereas class 2B, usefulness or efficacy is less well established but may be considered. Class 2A should be considered, class 2B is may be considered, class 3 is it is not recommended. So, we will see the role of antiplatelet drugs in stroke in 2 parts. One is the transient ischemic attack and acute stroke treatment and secondary prevention. Transient ischemic attack is a harbinger of stroke, and we have to be sure that we recognize it early so that we can prevent strokes. The transient ischemic attack or TIA is defined as a transient episode of neurological dysfunction, which is caused by focal brain, spinal cord or retinal ischemia without any acute infarctions. Whereas acute cerebrovascular syndrome or ACVS includes both TIA and ischemic stroke. TIA is a medical emergency because you have to prevent the stroke. We will just go through some cases. This is Mrs. M, who is a 33-year-old lady who presented with left hand and face weakness, and this had lasted for about 30 minutes and had recovered, and she came to the hospital 2 hours after the recovery. At that time she was not a known diabetic or there was no focal deficit. Only problem was her BP was on the higher side, 150/100. Neurological examination was normal, and she just wanted to know what to do next, and she was not very interested in doing further evaluation, though she was told about the recurrence rate. So, how do we realize the risk of stroke recurrence in these patients? We use what is known as a ABCD score. As you can see, this mnemonic stands for: A is for age, more than 60 years you give 1 point. B is for blood pressure, systolic more than 140 or diastolic more than 90 you give 1 point. This lady had 150/100, so she gets 1 point. Clinical features, she had with weakness which had recovered, so that is 2 points. Speech abnormality without weakness is 1 point. Duration of symptoms, she had about 30 minutes, so again this is 1 point. Less than 10 minutes is 0, more than 60 minutes is 2. Diabetes 1, she did not have. So, the total score in her was 4. And so, just keep it in mind, we will come back to this later. Now, there are modifications of ABCD square, and now you have a ABCD3, which the third D is for a dual TIA. This is another TIA which occurs within 7 days of the first TIA. Here the maximum points becomes 9, where the second TIA has got a point of 2. And then ABCD cube 1, this is imaging score is added. When you have at least 50% on stenosis on carotid imaging, you get 2 points, and an abnormal diffusion weighted image gives 2 points. So, the maximum score is 13 points in this. So, this lady whom we are talking, she had a score of 4. So, that is 4 to 5 is moderate, and risk for the recurrence of stroke is 4.1 within 2 days, becomes 9.8 within 90 days. And all high scores will be about 9.2 with 90 days. So, we have to prevent the strokes. Before that, we have to identify whether it is a actual TIA, it is a stroke mimic like a peripheral vertigo. Sometimes they develop slurred speech and blurring of vision, and they have palpitation, oscillopsy, etc. Sometimes can be mistaken for stroke. Migraines, headaches with focal neurologic deficit like hemiplegic migraine can also be mistaken for a stroke. Post-ictal deficit with seizures usually recovers fast, but sometimes can be as long lasting as 7 days, and definitely that has to be taken into consideration when you are going to treat for stroke. vestibular attacks can also mimic strokes, and hypoglycemia is one of the very common conditions which can mimic a stroke, where there can be full recovery provided it is treated earlier.